So I work at the New York City Department for the Aging with their HIICAP program. It's HIICAP, and we have a network of volunteer counselors that helps people with questions on Medicare and related health insurance. And I provide training and technical assistance for the counselors and presentations on Medicare for people with Medicare throughout New York City. Today we're going to do an overview of the federal Medicare program, including some very important changes for next year. Let's start with Medicare enrollment. Now, whenever I talk to people that are just becoming Medicare eligible, that are just turning 65, my first question to them is always, are you collecting Social Security? Because I know if somebody's collecting Social Security prior to age 65, they're going to be automatically enrolled in Medicare. But nowadays, many people are choosing to start collecting Social Security after 65. And if that's your situation, you will not be automatically enrolled in Medicare. And it'll be up to you to enroll in Medicare Part B, the medical insurance, during one of the enrollment periods. The first enrollment period is called the initial enrollment period. This is when people are first eligible for Medicare. It's a 7-month period. For most people, it's the 7 months surrounding the month they turn 65. So the 3 months prior to the month they turn 65, the month of, the 3 months after that. If you enroll in Medicare Part B in any of the 3 months prior to the month you turn 65, Part B starts the first of the month you turn 65. If you enroll the month you turn 65 or one of the next 3 months, Part B starts the first of the next month. Now, some people, when they turn 65, they're still working, or they're covered under a spouse who's still working, especially if they're working for a large employer where the employer insurance would be the primary insurance. They may want to delay enrollment in Medicare at 65. Why? To save the monthly Part B premium. If that's your situation and you are covered at 65 under your own or your spouse's active current employment, not retiree plan, not COBRA, but active current employment, you can delay Part B without penalty and then sign up later using the special enrollment period. So if you're turning 65, but you're still covered under your spouse who's working for the city of New York, you could delay Part B, and then a couple of years later, when your spouse is ready to retire, sign up for Part B then. And that's very common for people that are still working or covered under a spouse who's still working for a large employer at 65. Now, if you miss your initial enrollment period and you don't qualify or maybe miss the special enrollment period and then realize later, sometimes years later, people need Part B, they make them wait till the annual general enrollment period. That's every year, January through March. If you sign up then, your Part B starts the first of the next month, but you may have a late enrollment penalty. The late enrollment penalty is 10% of that year's standard premium for every full 12 months you delay. And that 10, 20, 30, 40, 50, 100% or more penalty, it's not one-time penalty. It is lifetime penalty. So I just want to stress to everybody that the only people that can delay Part B at 65 and not have to wait and not be subject to the penalty are the people that are still working or covered under a spouse who's still working. Now, when you do finally enroll in Medicare, they'll send you this red, white, and blue Medicare card in the mail, and it shows you the 2 parts of Medicare. Medicare Part A is your hospital insurance, covers you if you ever need to be admitted to the hospital. Medicare Part B is your medical insurance, covers you mostly for doctor services. So let's talk about cost in Medicare, starting with your Medicare Part B premium. Now, Medicare Part A hospital insurance, most everybody gets that for free, for no premium. But Medicare Part B, there's a premium attached. Most people pay the standard Part B premium, which this year is $174.70 per month. If you're collecting Social Security, it's taken out of your check. If not, it's billed to you directly. Besides a monthly premium for Part B, there's an annual deductible. This year, it's $240, and that means the first $240 in covered medical expenses, that's your responsibility, unless you have other insurance to pay it for you. Once you meet the deductible for most services, Medicare pays 80% of what they allow. You're responsible for the other 20%, the Medicare co-insurance. Now, it's different for lab tests and for most of the preventive services. They're covered in full by Medicare, 100%. But most every service, whether it's surgery or anesthesia or office visit, radiology, mental health, physical therapy, they're all paid by Medicare at 80% of what they allow once you have met the annual Part B deductible. Now that's how it works under Medicare Part B, medical insurance, mostly for doctor services. Medicare Part A works very differently. Although most everyone gets Part A for no premium, there's a large deductible if you need to be admitted to the hospital. This year, for a hospital admission of up to 60 days, Medicare pays everything but the deductible. You see, it's $1,632. If you're in the hospital beyond 60 days, for the 61st through the 90th day in the hospital, you're responsible for a daily copayment this year, $408 per day for those additional 30 hospital days. If you think that's a lot, if you're in the hospital beyond 90 days, Medicare allows an additional 60 what they call lifetime reserve days, which you can use once during the lifetime of your Medicare coverage in any combination. But once you've used them, that's it. They're non-renewable. For those 60 lifetime reserve days, you're paying a daily copayment this year, $816. And again, that's per day. If you are discharged from the hospital to a skilled nursing facility for rehab care, Medicare pays the first 20 days there in full. The next 80 days, you're responsible for a daily copayment this year, $204. And again, that's per day. And these Part A benefits, they're not a calendar year benefit like Medicare Part B. Part B is fairly simple. You got one deductible, $240 this year. Once you've met it, that's it. You're done for the year. But the Part A deductible, somebody may have to meet that more than once in the same calendar year because it's once per what they call a benefit period. A benefit period begins the first day you go into the hospital, and it ends when you've been out of the hospital, out of the skilled nursing facility for a period of at least 60 consecutive days, at which point your benefits renew. They start again. So for instance, let's say you were to go into the hospital tomorrow for 5 days. Medicare is going to pay everything except that deductible, $1,632. But what if the following week you need to go back into the hospital or a different hospital? Same condition, different condition, doesn't matter. Less than 60 days have gone by since you were discharged. You're still in the same benefit period. You just pick up where you left off at day number 6 of your first 60 days of coverage. You don't have to meet a new deductible. But let's say instead of being readmitted the next week, what if you're readmitted 3 or 4 months later? Could be the same calendar year, but now it's a new benefit period. More than 60 days have gone by since you were discharged. Your benefits renew. They start again. You're back to day number 1 of your first 60 days of coverage, and you have to meet a new deductible, $1,632. So I hope this slide will help to point out the importance of people having other insurance besides Medicare. Because for people that have Medicare only, like some people do, you could see they could wind up paying a lot out of pocket, especially for hospitalization. And when we talk later about Medigap, Medicare Supplement Insurance, you'll see how that fills in very nicely here. And that's a big reason why someone would purchase a Medigap plan. So far today, we're talking about one way to get Medicare: original, traditional, fee-for-service, straight, regular Medicare, Part A hospital, Part B medical, and about the gaps in coverage, deductibles, co-insurance. And if you're on original Medicare, there are some services that Medicare just doesn't pay for at all. These are the more common ones, including dental care. Medicare does not cover a routine vision exam, nor do they cover eyeglasses. One exception, they will pay for a pair of eyeglasses following cataract surgery. Otherwise, they don't cover eyeglasses. They don't cover hearing aids. And important to know, Medicare doesn't cover long-term care. Medicare covers what you saw on the last slide, short-term rehab care in a skilled nursing facility following a hospital discharge. Also important to know is that Medicare does not cover a routine annual physical exam. Now, you may have seen in the Medicare literature where they cover something called an annual wellness visit for all people with Part B. That's a much more limited exam. A comprehensive head-to-toe annual physical exam has never been covered under original Medicare. If that's the service you have, it's entirely out of your pocket. Also, Medicare does not cover services outside of the United States and its territories, like Puerto Rico, the U.S. Virgin Islands. So if you're traveling across Europe, Asia, Africa, even across Canada or Mexico, even in the event of an emergency, Medicare will not pay for those services at all. So if you're traveling outside the United States and its territories, you would want to find out if you have other insurance, which might pay for foreign travel emergency services, or you might want to purchase travel insurance, but Medicare outside the United States and its territories, no coverage. So for those that are interested in Medicare Supplement or Medigap insurance, these plans are identified by letter. There are 10 standard plans ranging from plan letter A to plan letter N as in Nancy. All these Medigap plans cover you for days 61 through 90 in the hospital at $408 per day this year. They all cover the 60 lifetime reserve days, the 816 per day. Plus, if you exhaust all your Part A hospital benefits, most people never get to that point, but all Medigap plans would cover you for an additional 365 days of inpatient care. Most Medigap plans pay the Part A deductible, that's $1,632 deductible this year. Most Medigap plans pay the 20% Part B coinsurance, and then other benefits vary from plan to plan. But let me tell you the two most important things to know about Medigap insurance. One is that the benefits are standard. So different companies sell these plans, and they charge different amounts. But as long as it's the same letter plan, doesn't matter what they're charging. It's exactly the same coverage. So it's well worth your while to shop around for the best deal on a Medigap plan. So for instance, if you buy Plan G as in George from AARP, and your neighbor buys Plan G from Emblem, they charge different amounts for exactly the same insurance. So you need to know it's a standard benefit. The other thing to know, in New York State, unlike most states, we have continuous open enrollment for Medigap insurance. So as long as you're on original Medicare and you live in New York State, you could purchase a Medigap plan anytime. And if you have a Medigap plan already and you live in New York State, you could switch to another Medigap plan, if not with the same insurer, by going to a different insurer. You cannot be denied Medigap insurance in New York State because of your age or because of your health. Now, although you could purchase a plan at any time if you're on original Medicare in New York State, you may be subject to a waiting period for pre-existing conditions of up to 6 months, which most but not all the insurers have. So what that means is, although they'll sell you a plan, they may not cover a service related to a medical condition you had prior to buying the policy in that first 6 months. Medicare itself has no waiting periods. Medicare covers you from day one, but the Medigap plan may not. However, most people we meet that buy a Medigap plan, they're able to avoid the waiting period because they've had some sort of prior credible coverage that can count towards that. And that could be most anything. It could be another Medigap plan. It could be a Medicare Advantage plan, employer plan, retiree plan, COBRA, a plan through the marketplace, the VA for veterans. As long as there's no break in coverage or a short break of less than 63 days from when that insurance ends and the Medigap plan begins, they will credit the time with the prior insurance towards meeting the waiting period. So for instance, if you're somebody that had some sort of employer or retiree plan the last 10, 15, 20 years, you lose that coverage, you buy a Medigap plan right away. You don't have to worry about pre-existing conditions. They will credit the time that you had the other insurance towards meeting that waiting period. Now, if you want to see a complete listing in New York State for all the Medigap insurers, the plans that they offer, the waiting periods, and the premiums, you should go to the New York State Department of Financial Services. This is the website, dfs.ny.gov. They have a chart they update every month to show you the most up-to-date information on Medigap insurance in New York State. And then I'll show you a chart here of the 10 Medigap plans, A through N, and the benefits that they offer. And I want to bring to your attention something that changed a couple of years back, and that is with Plan C and Plan F. You notice that F is the most comprehensive plan. C and F are the only two plans that cover the Part B deductible. That's that $240 deductible. Now, C and F are only available to people that became Medicare eligible prior to 2020. So if you turned 65 in 2017 or 18 or 19, you could buy Plan C or F today. But most people, if they're becoming Medicare eligible now, or they became Medicare eligible anytime after 2020 or later, they do not have the right to buy that policy. They can buy D or G, which you see is the same plan, just doesn't cover the deductible. But again, the most comprehensive plan is only available for people that became Medicare eligible prior to 2020. So if I'm talking to somebody that's just turning 65 now, I'll talk to them about Plan G, because that's the most comprehensive plan they can buy. But G can be expensive. If they're looking for a lower cost Medigap plan, I would then talk to them about Plan N, as in Nancy. The big difference between G and N is for office visits. Instead of covering the entire 20% coinsurance like Plan G, most plans do, with Plan N for office visits, there's a copayment of up to $20. But because there's that copayment with Plan N, they're able to offer that at a lower premium. If you're looking, though, for the lowest cost Medigap plans possible, those are the high deductible versions of Plan F and Plan G. You'll notice that F and G have an asterisk next to them. That's because there's a second version, covers all the same services as the standard standard effort G, but before they pay anything, you have to meet a deductible. This year, the deductible is $2,800. So, for instance, if you had the high deductible effort G and you were admitted to the hospital, that $1,632 Part A deductible would go towards the $2,800. The $240 Part B deductible would be credited towards that. The 20% coinsurance, the same thing. And if you reach that $2,800, you would have all the benefits of the standard effort G for the remainder of the calendar year while saving on the premium over the course of the year. For some people, they see the high deductible effort G as a catastrophic policy where they want to be in original Medicare and they are not anticipating very much in the way of doctor services, so they want a relatively inexpensive policy that provides coverage for them and caps their out-of-pocket expenses for Medicare covered services at no more this year than $2,800 for the year. They have not announced yet what the high deductible amount will be for 2025, and they have not announced yet what the Part A and Part B cost sharing will be for 2025, but we expect that to come out this month. Now I want to talk about the other way to get Medicare, to join a Medicare Advantage plan, a Medicare health plan. This is Part C of Medicare, and these are private plans that are contracted with Medicare to provide all of your Medicare benefits through a network of doctors and hospitals that accept the plan. These are the companies that send you so much mail, right? Especially this time of year, whether it's Aetna or Blue Cross, right, or Emblem or Fidelis or Health First or Humana. Many companies offer those plans. And most everybody's eligible to join. You just have to have A and B of Medicare, and you have to live in the service area of the plan. That's it. But unlike Medigap insurance, where if you're on original Medicare and you live in New York State, you could always purchase a plan or switch from one insurer to another. For most people, for Medicare Advantage, there's only certain times of the year that they're able to sign up or switch. So first of all, people can enroll during the annual election period, which is coming up starting October 15th through December 7th. If you enroll in a plan during that time, your plan will start January 1. If you're on a Medicare Advantage plan at the beginning of the year, there's a second enrollment period called the open enrollment period, January through March of each year, where anybody that's on a Medicare Advantage plan has one additional opportunity to either switch to another Advantage plan or to switch to original traditional Medicare. After March, for most people, whatever plan they're on, if they're on a plan at all, that's what they're going to have for the rest of the year. And it's important to remember, if you join a Medicare Advantage plan, you're not giving up your Medicare benefit. These private plans are required to cover at least what Medicare covers. Plus, as an incentive to join, they will cover to a limited extent some services that Medicare does not. So typically they provide limited coverage towards dental, towards eyeglasses, towards a hearing aid. They probably pay for that routine physical that Medicare doesn't. They might pay for foreign travel emergency services. They might pay for a gym membership for you, all things not covered by Medicare. What I think is the biggest incentive, especially in our New York City area, is that plans may be available for as low as zero premium. You may have seen them advertised. You're still going to pay that Part B premium, $174.70 or whatever you're paying for Part B. They're saying zero additional premium with Medicare Advantage plans. And that could be a very powerful incentive, I would say, for somebody that does not have retiree coverage, that does not have Medicaid, that cannot afford or doesn't want to pay $200 or $300 a month for the typical Medigap plan. You may be very tempted to join a zero premium Medicare Advantage plan instead. But even if the plan has no premium, that doesn't mean the plan has no cost for you. And it's going to cost you on the other end when you access care, usually in the form of a copayment. So some Medicare Advantage plans have no copayments for primary care doctors, but they all have copayments for specialists. Some are as high as $50 or even $55. If you're admitted to the hospital, most plans have a daily copayment up to a maximum number of days, $200, $300, $400 a day for the first 3, 5, 6 days in the hospital. If you need physical therapy or mental health, many plans have a $40 copayment. So the bottom line is not 100% coverage for most services under most plans, and you're going to pay something at the end of the day when you go to the doctor or hospital. But in fairness to the plans, it's not an unlimited amount that you're responsible for the year. All Medicare Advantage plans have a maximum out-of-pocket limit, abbreviated MOOP, not to exceed this year $88.50 in network. So if you have a plan with an $88.50 limit and you're admitted to the hospital, it's $300 a day for the first 3 days. Then $900 into your pocket goes towards the $88.50. If you're getting physical therapy, that's $40 each visit. The $40 is going towards the $88.50. If you reach that limit, most people won't, but if you do, 100% coverage for the rest of the year for all Part A and Part B covered services. That is the highest limit any plan can have this year. Some plans have that limit, but more plans have lower limits. And that's something you want to compare when you're looking at different Medicare Advantage plans, especially if you're concerned about having high out-of-pocket medical costs for the year. The other thing to consider is the type of Medicare Advantage plan. Medicare Advantage plans can come in a couple of different forms. They could be HMO plan. HMO plan is the most restrictive type of plan. With an HMO plan, unless it's an emergency, you can only use doctors and hospitals that are participating, that are in their network. If you go outside the network, you're going to wind up paying the cost out of pocket. But there are some companies that offer PPO, Preferred Provider Organization plans. Like the HMO, they also have a network of doctors and hospitals. And if you use their providers, you pay whatever copayment the plan has. The big difference, though, with PPO plan is you can go outside of their network to doctors and hospitals that take Medicare, but just don't accept that plan. And you'll pay more out of pocket when you do. You might even have to pay up front and then seek reimbursement from the plan. But for that reason, the PPO gives you more choice, more flexibility than does the stricter HMO plan. And then they have a special type of plan for people that are dually eligible, meaning people that have both Medicare and Medicaid. They can join, if they choose, a Medicare Advantage special needs plan, just for people with Medicare and Medicaid. And one of the advantages of this type of plan is that for all providers that are in their network, you still have a network of providers that you have to use. There are no copayments for covered services. It's covered completely for doctor and hospital services. But again, it's an HMO plan, so unless it's an emergency, you're going to use providers that participate. And the special needs plans, especially for people with Medicare and Medicaid that are able to join, might have as an attraction, besides some of the additional benefits we mentioned earlier, an OTC benefit, over the counter, where they get a certain amount per month or per quarter that they can use for non-prescription drugs for things like vitamins or medical supplies or other things. Sometimes people are even able to use that towards utilities, or if they have certain chronic condition, to use towards food. There is that additional benefit, which you see in many of the special needs plans, again, for people with Medicare and Medicaid. I spoke about the two ways to get Medicare: original traditional Medicare, which can come along with a supplement plan, or Medicare Advantage. It's one or the other for everyone with Medicare. And whichever way you decide to go, you're entitled to Medicare Part D. D is the prescription drug coverage. If you're in a Medicare Advantage plan, Part D is easy. You must get it from the plan, because if you're in a Medicare Advantage plan, you get all your Medicare benefits: Part A hospital, Part B medical, Part D drug, all from one plan. If instead you choose original traditional Medicare, you can purchase a separate standalone drug plan. If you live in New York State, this year they have 15 of those drug plans to choose from. Next year it'll be down to 12. Those 12 plans each have their own formulary, their own list of covered drugs. So not every one of those plans necessarily covers all your drugs. And they got their own network of pharmacies. So the pharmacy that you like, maybe they don't take all the plans. How do you compare so many plans? You have to go to the Medicare website, medicare.gov. They have this plan finder search tool, where if you enter the names of your drugs, not just the names, but the dosage, the strength, the quantity you take each month, and then select your pharmacy or pharmacies, the search tool will compare every plan and rank them based on your individual needs, from least expensive to most expensive. Realistically, you just consider the first few plans. If you're not comfortable using the website, you can call Medicare, 1-800-MEDICARE. They're open 24/7 all the time. They can do the comparison over the phone. If you're looking for local assistance, that's us, the HIICAP program. Our counselors are all experienced with the website. Sometimes pharmacies advertise they'll do this for you. We're all going to the same website to make the same comparison. And what I tell people is, you can't just do this once in your lifetime and think that you're done. But these plans can and do change every year. To everybody today that's on a Medicare Advantage plan, that's on a Part D drug plan, you should have gotten a notice from the plan by the end of last month about changes for next year. They update the website as of today, October 1st. And then you or somebody else should make that comparison again. And if you find there's a better plan for next year, the time to sign up is during the annual election period, October 15th to December 7th, for your new plan to start January 1. Now, what do these plans cost? Well, first of all, these 15 plans have a monthly premium, and it varies by plan. In addition, this year, plans can have a deductible of up to $545. Some plans have a $545 deductible, some have a lesser deductible, some have zero deductible. Once you meet the deductible, if any, people usually pay a fixed copayment at the pharmacy until they get to what they call the coverage gap or the donut hole. That begins at the point that you reach a little over $5,000 in total drug costs this year. Regardless of what you paid out of pocket, once the total cost of your drugs gets to be a little more than $5,000, you're in the coverage gap. At that point, you pay 25% of the cost of the drugs out of pocket until, for people with very high drug costs, they may reach what they call catastrophic coverage. Catastrophic coverage begins at the point that you get to $8,000 this year in true out-of-pocket costs. The acronym is TROOP, TROOP. So what does that $8,000 include? Everything you pay. Not the premium, but everything you pay at the pharmacy. The deductible, co-pays, co-insurance, the 25% during the gap. Plus, there's one thing you don't pay, but luckily still counts towards that $8,000. And that is for brand name drugs, which of course can be very expensive. You're getting during the coverage gap, you're paying 25%, but what you don't see is of the other 75%, 70%, most of that cost is a drug manufacturer rebate. Even though you don't pay it, still counts towards that $8,000. And that's very good for you because that gets you out of the coverage gap to the catastrophic coverage this year for many people without having to pay nearly $8,000 out of pocket. And for people that reach the catastrophic coverage this year, they have 100% coverage. Prior to this year, there was a 5% cost sharing, but this year, you reach catastrophic coverage, 100% coverage. And then the most important change is for next year. For 2025, it's going to work a little differently. There'll be a deductible, which next year could be up to $590. But once you meet the deductible, you'll pay a copayment or co-insurance and no more donut hole. Instead, you'll get to the catastrophic coverage at the point that you paid $2,000 out of pocket, not including the premium, but including the deductible and any co-payments or co-insurance. So this is a big change, especially for people with very high out-of-pocket drug costs. Again, their out-of-pocket costs for covered drugs. It'll be capped at $2,000, and that amount can change each year, but that'll be the amount next year. On top of that, Medicare has this Medicare Prescription Payment Plan, MPPP, that's going to start to go along with that cap. And they're going to allow people to actually spread out that $2,000 over monthly payments. So this could be very good for somebody that has very high drug costs, where they pay $2,000 within the first couple of months of the year. They won't have to do that next year if they choose to sign up. Instead, they can spread it out over the course of the year to make it more affordable for them. If you do sign up for that MPPP, what will happen is you will pay nothing at the pharmacy for covered drugs. Instead, that $2,000 will be billed to you by your Part D plan monthly. So for some people that have very low drug costs, it's not important for them. But if you have very high drug costs that you meet at the beginning of the year, consider signing up for that Medicare Prescription Payment Plan, which you would sign up with your Part D plan directly, and you can sign up at any time of the year you might want to. And if you sign up and it doesn't work for you, you can withdraw from that at any time. You're not locked into whatever you decide for next year. Now, some people have other prescription drug coverage from another source. Some people have retiree drug coverage that comes from a former employer or union. If it is what they call creditable drug coverage, you should have received a notice, or you should be receiving a notice from your former employer or union to let you know. Creditable drug coverage means it's as good or better than the standard Part D benefit. Most of the time it is, but not all the time. If it is creditable, the notice probably says, don't sign up for Part D. Because if you have creditable drug coverage and you sign up for Part D, which could be a Medicare Advantage plan with Part D, you could wind up losing your retiree drug coverage. You may lose other benefits as well. So most people that have creditable retiree drug coverage don't sign up for Part D. If in the future they lose it, even voluntarily, even in the middle of the year, they'll give them a special enrollment period at that point to join a Part D plan. We said earlier that people that have a Medicare Advantage plan, they get their Part D drug coverage from the plan. They don't get a separate standalone Part D plan. Those separate standalone Part D plans are for people in original Medicare to choose from. Veterans that have drug coverage through the VA is credible drug coverage. veterans that don't sign up for Part D, if they sign up for the future, they will not pay a penalty for late enrollment. Some veterans, though, may want to have Part D also to give them greater flexibility to be able to use a private pharmacy outside the VA system. So in this section, I'll talk about 3 programs that help people with their Medicare costs. The first is called Extra Help, or the Low Income Subsidy, LIS. This is a subsidy the government provides to help people with their Part D drug costs. Many people we see get this benefit automatically. So if you have both Medicare and Medicaid, and or you're on one of the Medicare savings programs I'll talk about, where the state pays your Part B premium, it's not taken out of your Social Security check, automatically you get extra help with Part D. If you don't have Medicaid and you don't have Medicare savings program, but you have limited income and limited resources, they will not give you the extra help automatically, but you can apply. The place you'd apply to is Social Security. You can apply any time of the year that you might be eligible, and you would apply best on the Social Security website, SSA or socialsecurity.gov. In addition to the help that Extra Help provides with your premium, and it could pay the premium, the entire premium. You can get a plan for 0 premium. It eliminates any deductible and reduce your copayments to only small copayments at the pharmacy. In addition, people with Extra Help are entitled to a special enrollment period where they can make one change in how they get their Medicare each calendar quarter in the first 9 months of the year. But that's changing starting next year. The people with Extra Help will be able to actually switch as often as once per month, but it will only allow you to switch into a standalone Part D plan with original Medicare. It will no longer allow you, starting next year, to enroll in a Medicare Advantage plan. So again, the special enrollment period for Extra Help next year, on the upside, it will give you more opportunity to switch as often as each month. On the downside, it will only allow you to enroll into a standalone Part D plan to work with original Medicare. Or if you're in one already, to switch from one standalone Part D plan to another. EPIC is for New York State residents that are 65 and over, that have incomes as high as $75,000 for a single, $100,000 for a married couple, much higher than the Extra Help limits, and they don't look at assets or resources. So whatever money you have in the bank, not concerned about that to qualify for EPIC, only looking at income. With EPIC, EPIC does not work on its own. EPIC only works as a supplement to your Part D drug plan. And it works with every Part D plan, where Part D is your primary, your main insurance. EPIC wraps around. EPIC helps to fill in the gaps in coverage. EPIC will not help with your Part D plan deductible, but after you meet the deductible, EPIC can help lower your copayment. For most EPIC members, they don't pay anything. It's a free program. So to give you an idea, if you had an income from last year, let's say between $20,000 and $75,000 as a single person, you would be, like most EPIC members, in the EPIC deductible plan. It's free coverage. You have to meet a deductible on a sliding scale based on your income before EPIC will help pay to supplement Part D. But if you're somebody that has Part D and you have an income, let's say $30,000, $40,000, $50,000, $60,000, I don't see any reason for you not to sign up for EPIC. Sometimes people say to me, I don't use a lot of drugs. I'm never going to meet this deductible. It's $1,000. It's $2,000. But I would say, so what? You don't meet the deductible. It's free coverage. In the meantime, you have EPIC in place should your situation change. Another benefit of EPIC is, unlike most people who could only change their plan during this fall enrollment period, EPIC members can switch their plan, Part D and or Medicare Advantage, one additional time each year outside of the enrollment period. So we help people apply for EPIC, not for the drug coverage at all, but just to be able to change their plan without having to wait till the next year. And EPIC had just added a new online application. Prior to that, it was only mail-in paper application, which you could still use if you prefer, but a new online application is now available at this link. And then the Medicare Savings Program. This is the most important benefit that we ever speak to people with Medicare about, because for people that qualify and apply, the state will actually pay your Part B premium. It'll put that $174.70 back into your monthly Social Security check. If you meet somebody that has Part B and they're not paying a premium, they're already on the Medicare Savings Program. But if not, they may qualify. So here's the income limits. If you look at the bottom of the slide, in New York State, they were increased greatly last year, so many more people qualify. Up to $23.55 for a single, $31.89 a month for a couple. Couple of other advantages to living in New York State is that they don't look at assets or resources. So like the EPIC program, only income to qualify. On top of that, even if your income's too high, you might still qualify. Because if you're paying privately for health insurance, they allow you to deduct your health insurance premium from your income to be eligible for this program. So for instance, if you're a single person, you have an income $2,600 a month, but you're paying $300 a month for your AARP Medigap plan, you can deduct that $300 from your income. Now you're eligible. Sometimes we meet people who's only slightly above the limit, their income, right? $5, $10, $15. For that person, it'd be worth it to buy some cheap dental policy or vision policy you might see advertised for $20 or $25 a month. Is paying that $25 a month. Now it brings your income down to where a program you can save $170, $470 a month. Plus, automatically, you get extra help for Part D. So this could be really helpful for somebody like who has low income but high resources that's struggling with their Part D drug costs. If they apply to Social Security, they're going to be denied extra help. Their resources are too high. But this is the back door to extra help, if you will. Apply for the Medicare Savings Program. They don't consider resources, and then automatically they'll get the same extra help with Part D. And even if you don't qualify yourself, you may know people that are eligible for extra help, the Medicare Savings Program and/or EPIC, and let them know they could apply at any time of the year, regardless of whether they get their Medicare through Original Medicare or a Medicare Advantage plan. So just to summarize for today, for those that don't have retiree coverage and who don't have Medicaid, here's your two choices in Medicare. It's either Original Medicare with the Medigap or it's a Medicare Advantage plan. Let's look at advantages and disadvantages of each. Why would you choose Original Medicare with the Medigap plan? Choice of providers. You go to any hospital across the country, they all take Medicare, as do most doctors. And depending on the Medigap plan, it could be pretty comprehensive coverage between the two. What's the downside? High premium for the Medigap plan, plus it doesn't cover your drugs. You need a separate Part D plan for another premium. So the people on the left here, they're paying 3 premiums every month. One for Part B, they're going to pay anyway. A second for the Medigap, a third for the Part D drug plan. So they pay the most in premiums, but in exchange, the most choice of providers, the most complete coverage. What about the other choice instead, Medicare Advantage? Why would you do that? You save on those premiums. You still have to pay the Part B premium, but some plans are as low as 0 additional premium. Plus, it includes the Part D. You don't need the Medigap. You don't need a separate Part D. You save on the premium, and you get some extra benefits that Medicare doesn't cover, like dental and vision and a gym membership. What's the downside? If it's an HMO plan, especially, unless it's an emergency, you're limited to doctors and hospitals that participate. And even if you don't pay a premium, we said earlier, that you pay on the other end when you access care, co-payment or co-insurance for most services under most plans, up to a maximum out-of-pocket for the year. Plus, this is managed care. So they cover your mental health and your physical therapy and your planned surgery, but you may need to get pre-approval, prior authorization before those services will be covered. So for some people, it makes more sense to have Original Medicare with the Medigap plan. Other people do very well with Medicare Advantage, and that's the choice for all people with Medicare. And now's the time to be making that decision as to which one you want for 2025, now that the information is becoming available for next year. If you need help comparing plans and you live in New York City, you can call us at the Department for the Aging, 212-AGING-NYC, and ask for HIICAP. For those that live outside of New York City but within New York State, this is the statewide phone number. You could put in your zip code, be directed to a local counselor in your county. For those that live outside of New York State or are thinking about moving outside of New York State, there are SHIP, SHIP, which is the federal name for our program, counselors throughout the United States and its territories. You can find them, a local counselor, at this link, shiphelp.org. If you want to learn more about Medicare, you can attend one of our Medicare orientation webinars. You can see our schedule and sign up to attend at this link. This is for people that live in New York City who are 60 and over, or are caregivers for people that live in New York City who are 60 and over. You can go to the Department for the Aging website to click on Your Opinion Matters to complete a survey, which is available in different languages.